Zoophobia refers to a fear of animals. Most of the time, this fear is directed at a specific type of animal. However, it's also possible for a person with zoophobia to fear all or many types of animals. Zoophobia is one of the many types of specific phobias. A specific phobia is an anxiety disorder in which you have an intense, exaggerated fear of something like an animal, object, or situation. Animal phobias are one of the most common types of specific phobia. A small 2018 research review assessed phobias across 3 large surveys. It found that zoophobia was consistently one of the most reported types of phobia. The exact cause of zoophobia isn't known. It's possible that several factors could contribute to the development of the condition. Having a negative experience with an animal may cause you to fear it. For example, someone who's been attacked by a dog may become afraid of dogs. We may also learn to fear animals from someone who is close to us, such as parent or sibling. For example, if your parent is terrified of spiders, you may learn to fear them as well. There's a possibility that genetics may also play a role in specific phobias. We process fear and anxiety in different ways. Some people may just be more anxious than others, making them more likely to develop a specific phobia. One of the main symptoms of a specific phobia is an overwhelming fear of something. This fear is typically exaggerated compared to the threat that the object of fear actually presents. In the case of zoophobia, someone feels an intense fear when exposed to an animal. It's important to note that exposure doesn't have to mean that an animal is actually present. A person with zoophobia may also feel fear when thinking about an animal, talking about an animal, hearing about an animal. Someone with zoophobia may also avoid activities that expose them to an animal. Some examples include avoiding watching nature documentaries, going to the zoo, or even going over to a friend's house when they have pets. It's possible that someone can develop a zoophobia to any type of animal. It's also possible that someone can have a fear of all animals. Taking care of yourself by eating a healthy diet, getting regular exercise, and making sure you get enough sleep can all help to reduce your symptoms. If you're finding that the physical symptoms of your phobias are interfering with your daily life, it may be a good idea to contact a mental health professional, such as a psychiatrist or psychologist. Mental health professional can speak with you about your feelings and symptoms. Using this information, they can develop a treatment plan that's right for your experience. Treatment options that are available for zoophobia include exposure therapy, cognitive behavioral therapy, medications. During exposure therapy, you will be gradually exposed to the object of your fear. The first sessions involve exposures that lead to the least amount of anxiety. Your therapist will also teach you skills to help you manage the feelings of anxiety that occur due to your phobia. These can include breathing techniques as well as relaxation techniques. Exposure therapy doesn't always have to mean an animal will be physically present. A small 2016 study showed that it's also possible that virtual reality can be used as a part of exposure therapy. Cognitive behavioral therapy is often combined with exposure therapy. With your therapist, you will work through the negative thoughts and feelings that lead to your phobia. You will then reshape these beliefs and emotions with the aim of reducing your fear. Medications are only typically used for specific phobias on a short-term basis. In some cases, they may be useful to help you cope with anxiety as you undergo treatment. 2 examples of medications you may be prescribed are beta blockers and benzodiazepines. Remember to always talk with your healthcare provider before taking any medication. If you enjoyed this video, subscribe, like, share, and comment.